Hello, Dr. Okker. There seems to be a lot of negative press about live blood analysis, mainly that practitioners from different training schools get different results. Why is this?
Well, there's a number of specific factors involved there, Elizabeth. Firstly, a lot of the training institutions or training schools focus only on one particular researcher's work or perspective, and only really focuses on that then in terms of interpretation of anomalies. So, for example, only pleomorphism, by endoline, or only nutritional type of assessments. So that is one important factor, is looking at what actual background is being taught in terms of the information included in the training course. And the other important factors as well, just the type of people involved in the training course. It's always best to look for a training course where the tutor has personal experience working with live data analysis as an actual qualified practitioner in a clinical practice. So you want to train with an institution that has experience with using live blood analysis in their own practices, and of course with the right type of equipment. A lot of training schools promote cheaper microscopes that don't actually have all the necessary specifications for dark field, which means that many anomalies are not actually visible clearly in dark field, where you should actually be able to see clearly at a much earlier point. Things are only becoming visible at a much later point because of the system being used. So the microscope and the specifications in the microscope is really extremely important to ensure that you get reliable results from the analysis, and of course the training provided to the practitioner as well.
Because there are a lot of schools out there that are taught by people that are not even qualified and also providing pretty, what can I say, not very efficient microscopes. So how do people find a good training course?
I think do a bit of research and look at who's actually presenting the course, what's their background, what their qualifications are, what type of microscopes are being recommended, and also very importantly to ask for some examples of the training materials. So if they're able to provide a short extract of the training manual so you can actually see the quality of the materials, that's really important. And we've noticed that over the years as well. That's something that varies quite dramatically as well. The content of the training material, how much information is actually included under each individual anomaly. So how completely it's actually discussed, where the practitioners would then have a proper understanding of what they're seeing, when they're encountering a specific anomaly in the blood. And also look at the pacing of the course. If it is a course that only takes a weekend to complete, the content in there is not really going to be enough to teach you everything that you should know, to properly use live and dry blood analysis to its optimal potential.
And what sort of qualifications would you be looking for in the teacher the training course?
Well, yeah, the tutor needs to be qualified as a health practitioner. Now, we don't use live blood analysis as a medical diagnostic tool, so it's not really important for the tutor to have a medical background, but definitely a background in healing and natural health. So I'm a naturopath and homeopath, and this is, a tool used in a natural health type of practice. So, you'd want to have a tutor who has that type of background, not just the qualification, but also the clinical experience as well.
Yes, you've had a lot of clinical experience, yes.
Well, yes. Since the early 2000s, since about 2001, I've been working with live and dry blood analysis in my own practice. And, working with it in your own practice, the sort of real world practical application, working with it with actual live clients, really teaches you a lot more, than just the theoretical kind of knowledge from what you learn from a textbook. There's a lot more that you learn from working with clients as well. So all of that really is extremely important. That the tutor has that type of background.
Okay, thank you very much for that. Thank you.
All right. Thank you. Thank you.